All right, so get ready to dive into a topic that you might not expect, the link between spinal surgery and GI issues.
Interesting.
Specifically in French Bulldogs.
Ah, Frenchies.
Yeah, we're looking at some new research that came straight from the Frontiers in Veterinary Science Journal from September 2024.
Okay.
It's all about what happens in a Frenchie's gut after they have surgery for back problems.
Yeah, it's an area that I think often gets overlooked.
Right.
But as this study is highlighting, it's definitely something that we should be paying more attention to.
Absolutely. To set the stage, we know French Bulldogs are popular,
Yeah.
but they're also predisposed to intervertebral disc herniation,
Right.
IVDH.
IVDH.
And it's the most common neurological issue they face.
And not just common, but significantly more so than other breeds.
Oh, wow.
Research from O'Neill and colleagues in 2018 and 2021 showed that French Bulldogs are 3 times more likely to have spinal cord issues compared to other breeds.
Wow.
And almost half of all neurological cases in Frenchies are due to IVDH.
That's a startling statistic for sure.
Yeah.
Can you explain for our listeners who might not be familiar, what is IVDH?
Sure. It's essentially when the cushioning discs between the vertebrae, those little shock absorbers in the spine,
Right.
they start to degenerate and they can bulge or even rupture, pressing on the spinal cord.
Oh, wow.
And this can lead to pain, weakness, and even paralysis.
So this study from researchers at Willows Veterinary Center and Northwest Veterinary Specialists in the UK,
Okay.
they looked at 97 French Bulldogs who had undergone spinal surgery for IVDH between 2017 and 2023.
Okay.
And they were particularly interested in the frequency of gastrointestinal problems or
Yeah.
GI problems after surgery. And they found that a whopping 76.3% of those French Bulldogs had GI signs like vomiting, diarrhea, or regurgitation.
Wow, 76%.
Yeah, over 3/4 of the dogs in the study.
That's alarmingly high. I'm guessing that's not typical for other breeds post-spinal surgery.
It does seem to be particularly pronounced in French Bulldogs.
And what's even more interesting is that most of these GI issues, 66.2% to be precise,
Okay.
actually cropped up after the surgery, not before.
So the surgery itself or the recovery period seems to be a trigger.
Right.
Were there any specific types of GI issues that were more common than others?
Diarrhea was the most frequent culprit, affecting 68.9% of the Frenchians that had GI problems.
Okay.
Regurgitation followed at 51.4% and then vomiting at 29.7%.
It's a lot to consider for anyone with a Frenchie facing spinal surgery.
Sure.
What are the researchers saying might be causing these problems?
Well, they suggest a few possible culprits. The stress of hospitalization and surgery itself is a big one.
Yeah, makes sense.
Think about it. Anesthesia, pain meds, unfamiliar environment.
Yeah.
It all takes a toll.
Right.
And then you've got the medications, particularly NSAIDs like meloxicam, which are commonly used for pain management after surgery.
Right.
And those can be tough on the stomach.
Yeah.
And a significant portion of the dogs, 78%, were on NSAIDs post-surgery.
So we're seeing a combination of stress, potent medications, and maybe even something inherent to the French Bulldog breed.
That's right. Researchers also point to the French Bulldog's brachycephalic conformation, that flat-faced structure as a potential factor.
Okay.
We know that brachycephalic breeds are prone to breathing issues.
Right.
But it seems like their unique anatomy might also make them more susceptible to GI problems in general.
So maybe a perfect storm of factors at play here.
It seems likely, and these GI issues weren't just a minor inconvenience either.
Right.
The study found that Frenchies with GI trouble stayed in the hospital longer after surgery,
Oh, no.
averaging 4.6 days compared to 3.7 days for those without tummy issues.
That makes sense.
If your dog is having digestive issues on top of recovering from surgery,
Right.
vets are going to want to keep them for observation and treatment.
Yeah.
They also looked into whether the length of anesthesia had any impact on GI issues.
Yeah, that's interesting.
Interestingly, they found that dogs who had a single anesthesia session for both imaging and surgery
Okay.
and then developed GI issues had significantly longer times under anesthesia compared to those who didn't.
So that's another piece of the puzzle. Longer anesthesia could potentially increase the risk.
Right, and this is specific to dogs who had both procedures under one anesthesia session
Okay.
and weren't showing GI signs before surgery.
So did they mention what the average times were for those groups?
Yes. The Frenchies who developed GI signs after a single anesthesia session had an average time of 269 minutes under anesthesia,
Okay.
compared to 222 minutes for those who didn't have GI problems.
That's a noticeable difference for sure.
Yeah, it's definitely something for veterinary neurologists to be mindful of when they're planning these procedures.
Right.
Perhaps minimizing anesthesia time whenever possible could help reduce the risk of GI complications.
But even with these complications, I'm hoping the news isn't all bad.
Thankfully, no.
Okay.
The good news is that most GI issues resolved within a few days. An average of 2.2 days, to be exact. And all 97 dogs in the study survived to discharge.
That's a huge relief. So we've established that GI issues are surprisingly common after spinal surgery in French Bulldogs.
Right.
We've explored some possible reasons why. What does this all mean for someone listening who might have a Frenchie facing spinal surgery?
Well, this study provides valuable information for both veterinary neurologists and owners.
Okay.
If your Frenchie needs spinal surgery, be aware of the potential for GI complications afterward.
Okay.
Open communication with your vet about the risks and benefits of different pain management options is crucial.
Right.
Especially considering the potential impact on the GI system.
It seems like this study raised more questions than it answers.
Absolutely. It's a springboard for further research. What's the exact mechanism behind this connection between spinal surgery and GI issues?
Right.
Are there specific things we can do before or after surgery to minimize the risk?
Right. Are French Bulldogs just more sensitive after spinal surgery? What can we do to support their gut health during recovery?
That's the burning question. More research is definitely needed to get a clearer picture and develop strategies for better management.
Now let's delve into the specifics of what the study found regarding the types and frequencies of medications used to manage these GI problems.
Okay.
It might shed some light on potential areas for improvement in post-operative care.
All right. The study found that the majority of the French Bulldogs, specifically 76%, received some form of medical therapy to address their GI issues.
Right. Okay, so what kind of medications are we talking about here?
A range of medications were mentioned, including meropetent, metoclopramide, metronidazole, omeprazole, ondansetron, a probiotic paste, and sucralfate.
So each of these is targeting different aspects of GI dysfunction.
Right, from reducing nausea and vomiting to protecting the stomach lining and managing inflammation.
So were proton pump inhibitors like omeprazole commonly used?
Yeah, omeprazole was used quite a bit. Over half of the dogs in the study, 56%, were given omeprazole at some point. Interestingly, it wasn't just used after GI problems cropped up.
Right.
Some dogs were given it prophylactically, meaning before surgery.
Oh, interesting.
To try and prevent GI issues from developing in the first place.
That proactive approach makes sense, especially with such a high likelihood of GI issues in this breed.
Right.
Did they look into whether the prophylactic use of omeprazole actually made a difference?
Unfortunately, the study didn't specifically assess the effectiveness of the medications themselves.
Okay.
It was more about documenting what was used in practice, not necessarily evaluating outcomes.
I see. So it provides a snapshot of current practices, but leaves the door open for future research to delve into the effectiveness of those practices.
Exactly.
Okay, what about medications that might contribute to GI issues, like NSAIDs or corticosteroids?
Right.
Were those used before the dogs even came in for surgery?
Yes, it turns out that a large majority of the dogs, 77 out of 97, had been given either an NSAID or corticosteroid in the 24 hours before they presented for surgery.
Okay.
The vast majority, 74%, had received an NSAID.
So NSAID use was pretty standard practice in these cases.
Yeah.
Did they note which NSAIDs were most frequently used?
Meloxicam was the most common NSAID prescribed, followed by carprofen, grapaprant, and robenacoxib.
Interesting.
And out of the 72 dogs who had received an NSAID before presenting for surgery, 54 of them ended up developing GI signs while hospitalized.
That's a significant number. It makes you wonder if the preoperative NSAID use might be playing a role in these GI issues.
Yeah, it's certainly a factor worth considering.
Right.
Now, when it comes to corticosteroids, only 4 dogs had been given them before presenting for surgery. 3 of those 4 had their corticosteroids discontinued before surgery, and only 1 of them ended up with GI issues afterward.
So it seems like corticosteroids weren't as commonly used in this group compared to NSAIDs. Did they look at medication use after surgery as well?
Yes, they did. A significant number of the dogs, 76 out of 97, were prescribed an NSAID after surgery as part of their pain management plan. And unfortunately, out of those 76, 56 developed GI signs.
Not surprising, given what we've already discussed about the potential impact of NSAIDs on the GI system.
Right.
Did they specify which NSAIDs were used post-operatively?
Again, meloxicam was the most common,
Okay.
given to 86% of the dogs that received a post-operative NSAID.
Okay.
Robenacoxib, carprofen, and grapiprant were also used, but to a lesser extent.
So it seems like meloxicam was the go-to NSAID both before and after surgery.
Yeah, pretty much.
Did they make any adjustments to the medications if the dogs started showing GI signs?
Yes, in some cases they did.
Okay.
For 17 of the dogs who developed GI issues after receiving a post-operative NSAID,
Right.
the NSAID was withdrawn specifically because of those GI problems.
That seems like a sensible approach, especially given the potential for NSAIDs to exacerbate GI upset.
Right.
What about corticosteroids after surgery?
Only 2 dogs were given corticosteroids while hospitalized, and both of them developed GI signs.
With such a small number, it's hard to draw any firm conclusions about a link between post-operative corticosteroids and GI signs in this particular study.
Yeah, for sure.
It seems like there's a lot of variability in how these medications were used
Right.
and whether they were continued or discontinued based on the individual dog's response.
Absolutely.
And the study authors acknowledged that their ability to assess the impact of different treatment approaches was limited
Right.
because of the retrospective nature of the study.
Exactly.
It's always a challenge with retrospective studies.
It is.
You're relying on medical records that weren't necessarily designed to answer the specific questions you're asking.
For sure.
But even with those limitations, this study reveals some important patterns and raises crucial questions about the role of medications,
Right.
particularly NSAIDs, in the development of GI issues in French Bulldogs after spinal surgery.
Absolutely.
Speaking of the surgery itself,
Yeah.
did they look at whether the type of spinal surgery performed had any impact on the occurrence of GI issues?
They did. They documented whether the dogs had mini hemolaminectomies,
Okay.
hemolaminectomies, or ventral slots.
Okay.
Interestingly, they found no statistically significant difference in the development of GI signs between those different surgical approaches.
So it doesn't seem like the specific surgical technique is the primary driver of these GI problems.
Precisely. It points to the likelihood that it's a combination of factors, as we've discussed, that contributes to this high incidence.
Now, earlier we touched on the potential impact of anesthesia duration.
Right.
Did they delve into that in more detail?
Yes, they were able to obtain complete records for anesthesia duration,
Okay.
including both imaging and surgery time,
Okay.
for 90 out of the 97 dogs.
That's a pretty solid sample size.
Yeah.
What did those records reveal?
Well, for French Bulldogs who had both imaging and surgery performed under a single anesthesia session,
Okay.
and who didn't have GI signs preoperatively,
Okay.
those who developed GI signs after surgery had a significantly longer time under anesthesia compared to those who didn't.
So it seems like the length of anesthesia, at least in those specific cases, is a potential risk factor.
Right.
So did they mention what the average times were for those groups?
Yes. The French Bulldogs who developed GI signs after a single anesthesia session had an average anesthesia time of 269 minutes.
Okay.
While those who didn't experience GI problems had an average time of 222 minutes.
That's a considerable difference.
Yes.
It's definitely something for veterinary neurologists to be mindful of when planning these procedures.
For sure.
Perhaps minimizing anesthesia time whenever possible could help reduce the risk of GI complications.
It's certainly a factor to consider.
Okay.
Now, shifting gears a bit.
Okay.
Let's talk about the overall outcomes for these dogs. Did the GI issues have any lasting negative effects?
Yeah.
Were they able to track how long it took for those GI problems to resolve?
Let's dive into that. What did they find out about how long those GI issues lasted? Let's dive into that. What did they find out about how long those GI issues lasted?
They were able to get data on the resolution of GI signs.
Right.
For 52 of the 74 dogs that experienced GI issues.
Okay.
The average time for those signs to clear up was 2.2 days.
Okay, so on average, a couple of days.
Right.
Was there a lot of variation in that time frame?
There was some variation, yes.
Okay.
The median time to resolution was 3 days,
Okay.
with a range of 1 to 20 days.
Wow.
So while there were a few outliers who took a bit longer,
All right.
most dogs saw their GI issues resolve fairly quickly.
That's good to hear. And then what about the length of their hospital stay overall?
Right.
Did having GI issues significantly impact that?
It did. The average duration of hospitalization from surgery to discharge was 4.4 days for all 97 dogs.
Okay.
However, when you break it down, The 74 dogs who developed GI issues had an average stay of 4.6 days,
Okay.
compared to 3.7 days for the 23 dogs without GI problems.
So almost a full day longer for those dealing with tummy troubles on top of recovering from spinal surgery.
Right.
It seems intuitive, though, that if a dog is struggling with GI issues,
Right.
they might need extra time to recover and stabilize.
Exactly. And it's important to remember that these are just averages.
Right.
Individual recovery times will vary depending on the severity of the GI issues.
Of course.
The dog's overall health and other factors.
So while these findings give us some benchmarks,
Right.
it's crucial to treat each dog as an individual and tailor their care plan accordingly.
Absolutely.
Now, the big question.
Yeah.
Despite these complications, did all of the dogs ultimately recover and go home?
Yes. All 97 dogs in the study survived to discharge.
That is excellent news.
Is good news.
It sounds like while these GI issues are a concern
Right.
and can certainly complicate the recovery process,
For sure.
they don't appear to be fatal in these cases.
That's correct. And the researchers emphasized that severe life-threatening GI complications in dogs after IVDH surgery
Okay.
are possible, but exceedingly rare.
That's reassuring to know. Did they look into whether any of the dogs still had lingering GI issues at the time of discharge?
Yes, they had follow-up data for 54 of the 74 dogs that had GI issues.
Okay.
Of those 54,
Yeah.
47 or 87% were free of GI signs within 24 hours before being discharged.
That's a very encouraging number.
It is.
What about the remaining 13% who are still experiencing GI issues?
There were 7 dogs in that category.
Okay.
One of those dogs ended up needing to be readmitted 3 days later
Oh, wow.
for further treatment of those ongoing GI issues.
So even though the vast majority recovered quickly,
Right.
there were a few cases where those GI issues were a bit more persistent.
Yes.
Did they follow those dogs after they went home?
There wasn't a lot of information on post-discharge outcomes.
Okay.
They did mention 2 cases where owners reported continued GI signs at home. And those dogs ended up seeing their primary veterinarian for further treatment.
It seems like those lingering GI issues weren't serious enough to need another hospitalization,
Right.
but they did require some ongoing management.
Precisely. And it highlights the importance of continued monitoring
Yeah.
and communication with your vet,
Of course.
even after your dog is discharged.
Absolutely. So much can change once a dog is back in their home environment.
Sure.
This study really brings to light the complex interactions between spinal surgery,
Right.
pain management, and gastrointestinal health in French Bulldogs.
Absolutely.
And while we've uncovered some important information,
Right.
there's still many unanswered questions.
Absolutely. The study serves as a springboard for further research.
Yeah.
Not only into the underlying causes of these GI issues,
Right.
but also into the development of effective strategies for prevention and management.
It sounds like there's a growing recognition of the importance of addressing gastrointestinal health in these dogs,
Yes.
both before and after spinal surgery.
Yes, and that's a positive development.
Yeah.
This research provides a solid foundation for improving the well-being of French Bulldogs undergoing spinal surgery.
Now, throughout this deep dive, we've talked about potential culprits.
Right.
But can we pinpoint what's at the heart of this connection between spinal surgery and GI distress in Frenchies?
Right.
Is it the stress, the medications, their unique anatomy,
Right.
or a combination of all these factors?
That's the crux of the matter, isn't it?
Yeah.
This study sheds light on the problem,
Right.
and those potential connections are certainly intriguing,
Yeah.
but we need more targeted research to really unravel the complexities of what's going on.
It's a fascinating area for future study.
It is.
This research is a valuable first step in addressing a problem that may have flown under the radar for too long.
Absolutely. By raising awareness and prompting further investigation,
Right.
we can work towards ensuring better outcomes for these dogs.
From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.